So we're going to start a meeting. I'm, first of all, really delighted to welcome everyone here today. It's great to have the opportunity to really shine the spotlight on palliative care in neurodegeneration. And I'm just going to set the scene because we've a lot of disciplines in the room. So a lot of people from healthcare and social care backgrounds, but we have people from legal backgrounds, technology, and so I'm actually just going to briefly introduce palliative care and neurodegeneration so that everyone's starting from the same page. So I had thought that every single talk today would start with what is palliative care, but luckily you're only going to have to get it once from me at the start. So this is the WHO definition of palliative care, and it's really focusing on quality of life for a person and their family with a life-threatening illness or a life-limiting illness by assessing and treating symptoms, but not just physical symptoms, psychosocial and spiritual symptoms. So it's a really excellent definition for us. And when I think about what palliative care really means and what it does so well that perhaps in general care we don't have time or we don't think about doing, it's that really holistic approach to a person, looking at the whole person rather than focusing in on one symptom or one aspect of a disease. That really truly person-centred, so we talk about this lip service to person-centred care, but I think palliative care is truly person-centred, and it's not focusing on the length of your life, it's focusing on the quality of your life. And then care planning is such an intrinsic part of palliative care, and including the family and communication throughout the disease. So when you look at the essence of palliative care, you can see how it instantly applies to neurodegenerative conditions, whether it's dementia or Parkinson's or some other neurodegenerative. You see how this really fits well. And I like to kind of put out what I call like the washing line of the neurodegenerative journey. So it starts with diagnosis, and this is a shocking time for a lot of people. It's their worst fear confirmed. And at some stage the disease progresses, and the person then obviously coming close to death can be a very stressful time for family and carers. And depending on the neurodegenerative disease, whether we're talking about dementia or motor neuron disease, or we're talking about a progressive neurological condition like multiple sclerosis, you will have different symptoms. Cognitive symptoms, psychological symptoms, partly as a reaction to the disability you have, and often in a lot of neurodegenerative diseases, it is a core feature of the disease. So, you know, a lot of dementias have depression as a core feature. And maybe that's a bit different to things like cancer and heart failure. You know, we must remember there's pathology in the brain, so maybe more pronounced psychological symptoms, particularly in something like, say, Huntington's disease. And then physical symptoms, and again, it'll vary depending on the disease. So some have very strong physical symptoms from the start. Again, think of Parkinson's disease, and some maybe like Alzheimer's dementia, you don't tend to have so many physical symptoms at the start, and they'll come later in the disease. And then we mustn't forget social symptoms, the huge effect of not being able to drive anymore, not being able to play golf anymore, not being invited to card games anymore, and the huge caregiver burden. And obviously spiritual symptoms as well, which I think often busy services totally overlook. So that's some, you know, everyone's journey is different, even in the same disease. No two people with dementia are the same. And across neurodegenerative diseases, people will have more or less of any one symptom. But when we start to look then at what should we be providing, well, clearly communication and information is so important, particularly at the start, but really all throughout the disease. We have to be looking at keeping the lines of communication open with the person and with their family. The support and care of the person and their family, their needs will ramp up and up and up because it is a degenerative condition. And so we need to be able to look and to assess their needs and provide it. A lot of people at some stage in their journey will transition to residential care, and this is a huge point in the journey of a person with neurodegeneration. And advanced care planning, this isn't something that we should be thinking at the end, and I'm sure Karen is going to go through this now in detail. When you lose your ability to think clearly or to speak, you can't be waiting to the end of a disease to start to tell people what's important to you. And at some stage, we moved to focus on end-of-life care in the last few hours or days of life. And obviously, this is a huge part of care and getting it right. This is what the family are left with afterwards. We need to make sure we do it well. And bereavement care. And again, if you have a disease that strips a person of their personality or their speech, or they move into residential care, that can happen very early in a neurodegenerative disease, that the family are already grieving long before the person ever dies. And obviously, bereavement care needs will extend sometimes long after the person has died. And a lot of times when we're thinking about palliative care needs, we are going back again and again to cancer, because most of the palliative care research has been done in cancer populations. And so we have these statements like the symptom burden in dementia is equal to the symptom burden in cancer. In advanced Parkinson's disease, it's like metastatic cancer. Patients with motor neuron disease have more hopelessness and suicidal thoughts than metastatic cancer. And in a way, I think it's useful to use the research that's there for cancer. But palliative care for neurodegeneration is very different, because people will have cognitive decline and speech decline early on. The time frame can be so different. Two people with Parkinson's disease, one will live for 10 years, one will live for 3 years, depending on the form they have. And look at dementia. You know, when we have that umbrella term, dementia, it's so variable. And it's really difficult to prognosticate. If you have somebody who has a 5-centimetre lung tumour with spread to their liver, you actually have a very good idea of what their life expectancy is with treatment and without treatment. But what's the life expectancy of somebody the first year they're diagnosed with dementia? Is it 5 years? Is it 20 years? You don't know yet, because you need to see the course. So it can be challenging. And I've shown you here a graph showing a cancer patient where they have very high functioning for quite a period perhaps, and then quite rapidly towards their death they decline. So the last 2 months are bad. The last 3 months are bad from the function point of view. And then compare it on the bottom to the person with, maybe an older person who's frail and has dementia. They may have a very prolonged period of very poor function, and they may have times during that when it looked as if their death was imminent, and then they recovered again. And that's such a different paradigm to cancer. And so again, I think this is why we need to have really good research in palliative care in neurodegeneration. And I think there's a great opportunity for cross-disease learning. I think a person with Alzheimer's dementia and vascular dementia have a lot in common. A person with motor neuron disease and Parkinson's disease have things in common. So where we have intrinsic diseases that are affecting memory and speech and swallow, we can learn a lot from them. So I hope that today we're using dementia as our kind of exemplar disease, but I hope that we will be able to incorporate learning from other diseases, and equally that what in the future we learn about palliative care needs in dementia can be applied to other neurodegenerative diseases, because I would make the case to you that they're a lot more similar than heart failure or cancer or COPD. So it's a great opportunity to learn. So I hope I've given you a flavour of why we're here today. You know, that this is such an important topic. And now I want to give you a little bit about what are we doing today? So you can see that we have a program. So I just wanted to set the scene. And now I'm just going to go through a little bit some of the things that we're going to be doing during the day. So just after I finish speaking, you see a thing called Speed Dating Forum. And you're probably saying, what's that about? So when people came in, there was your table plan. We've deliberately sat you with people that some you'll know, but some you won't know. And we want each table to introduce themselves to the other people, or the people at the table to introduce themselves to the other people. I nearly said there, I want the tables to introduce themselves to each other. So everyone at a table has about a minute to introduce themselves to the other people at the table, who you are, why you're here, what you're hoping to get out of it, what you think you bring, whatever you think is relevant. And so we had one person's name in bold at the top of each table. I hope the people saw that as they went in. And that person has the unenviable task of, if anyone goes over a minute and is waffling on a bit, to say, maybe we'd like to move on to the next person. People who saw that their name was highlighted in bold, can you put your hand up in the air? Okay. So we just have one table where we haven't, two tables. So Karen, well, it's easy. Would someone volunteer maybe here just to be the person? Yeah, perfect. So Joan's going to, Mary. Mary's going to do it at that table. All right, so we're going to start that in a second, but we've one or two other housekeeping things first. When we're finished the speed dating forum, we're going to move to lightning talk. So you will have seen on your programme that there's a few different organisations' logos, and these were the organisations, the partners that came together to put in our application for this workshop. And I suppose this is where I need to really highlight, this is funded by the Irish Research Council, and we're really grateful to get the opportunity to have everyone here today. So we're the partner organisations who applied for the grant to host the workshop and have organised it. And so everyone is going to give a 6-minute talk on who they are as an organisation, and I suppose their own particular perspective on palliative care in neurodegeneration and in dementia. We're going to be keeping rigorously to time. For the people who are doing the talks, after 5 minutes, there's going to be a traffic light system. So your green is going to turn to orange, and then when your time is up, it's going to turn to red. I will come over and physically remove anyone from the podium who keeps talking. Don't think I won't. So we'll try to stick to time. And then after that, we're going to move to the first of our 5 discussion pieces today. So we've picked 5 topics that we think are challenging in palliative care and neurodegeneration. And so the plan is that a speaker is going to speak for about 15 minutes to introduce it, to maybe talk about the research they've done themselves, or to talk about what's known in the area, what they think the gaps are. And then we're opening it up to the floor. We're going to have roving mics, and this is really why everyone is here today, to come together as a group and to discuss it. So we have about 20 minutes of discussion for our first talk, and then you'll have a well-earned tea and coffee break. And that's going to be the format for the rest of the day. Just to let you know, after lunch, you'll be coming back to a different table. And again, first thing after lunch, we're going to do the speed dating again, that you're going to get to introduce yourself to a different group of people. And then we'll take you through the rest of the day as you go on. I suppose just 1 or 2 other quick housekeeping things: to turn off your mobile phone. The bathrooms, as you've seen, are out just in the little foyer there. And during the coffee break, and for the last 15 minutes of the lunch break, we would invite you to come to visit posters. So we have early career researchers who have put posters in today, maybe some not so early, and to come over and to visit the posters, and also to visit the stands. So the partner organisations have stands. If you've heard something in the lightning talk and you think, I'd like to know more, I'd like to get some literature, please feel free during the coffee breaks, and at the last 15 minutes of the lunch break, we'll be manning our stands. So that's all I need to tell you about it. So the next thing we're going to move on to is over to you, to your speed dating. So again, if you want to start at your own tables, just to have a chat for, we'll say, about 8 or 10 minutes to introduce yourself to the other people. All right.